Hey everyone, how are you? I want to show you first of all on what I have to wear before I walk into the medical floors. So this is a surgical mask, an N95. And a hair cover. So first I want to thank everyone again for keeping all the healthcare workers in their minds and prayers. And wanted to do a short video and not text this because I think the video will get the point across better. Today was a tough day in the hospital. Like I discussed over the conference call, is what I was hoping not to happen was running out of vents. I don't listen to the news. I don't know what's, what the mayor, what the governor is talking about on getting vents, when they're coming in, when they're not coming in. But today we had a meeting, and we are going to start making decisions on taking patients off ventilators and basically liberating them to death. We have not had any patients come off ventilators since they were on them. Most of these patients are over 60 years old with medical problems, and we do see no hope for them. We are making these decisions on patients that have all indication of not making it. No matter what treatment we use, we are using up ventilators on patients that are not going to make it, basically. And it's a tough decision to make. The rapid increase in patients requiring it and the length that they are requiring is not sustaining to the number of patients needing it. And it's a tough time now for any healthcare provider to make a decision on who to live, who that should live, and who actually needs it. Please, everyone, stay home. Use all the precautions. If you don't need to be in the hospital, please do not be in the hospital. Call the hotline number if you have symptoms, and they will direct you whether you should come in or not and what to do. Again, I wanted everybody to get an inside understanding of what Northwell is going through. We are running out of ventilators. We are running out of personal protective equipment. And now we are making a decision to take off patients on ventilators that really don't see any hope for them. Of course, we're using all the right protocols and talking to family before we do anything. But it's a grim outlook right now. It doesn't look like it's getting better. I wake up every day thinking that today will be a better day with no admissions, no intubations, no ventilator use. But it's something that it's very hard to take emotionally. The biggest muscles I've been using is my brain, and it's hard to use right now after a 13-hour shift. But again, thank you for keeping everybody, all our healthcare providers in the group, in mind. But if you guys can do what you're supposed to do and stay home and take care of one another. And that will probably help us in the short and long term. Thank you, and have a good night.